you hear this, someone somewhere is losing that sound and forever. Every 30 seconds, every single 30 seconds, one person is dying from malaria. Not from cancer, not from a car accident, but from a mosquito bite. The time it takes you to tie a shoelace, one person is dead, and by the time it takes you to brush your teeth, 4 people are dead. In 2024, 280 million persons got sick from malaria, and 610,000 died out of malaria. But I know what you're thinking, that there's a vaccine, right? Yes, there is, and it is a miracle. But malaria is not a dragon that you can just slay with one sword. It is a hydra. Cut off one head and multiple others grow. So we need an arsenal. A full arsenal, 7 shields, 7 weapons we already have in our power that have saved 10 million lives since the year of 2000. In this video, we are going to be sharing those arsenals. Please tell them about the $2 miracle.
Something so cheap, something this simple. This piece of fabric has prevented up to 7 million lives since the year 2000. It is the long-lasting insecticide net. It forms a barrier. When you hang it in your sleeping space, stuck under your mattress, it forms electric fence, not just a fence. It is also soaked in insecticide, which kills the mosquito. But mosquitoes have now developed resistance to this insecticide. Well, the good news is the invention of the newer generation net, the PVO and dual active net, which has been estimated to prevent transmission of malaria by 94%. Wow, bigger than the long-lasting insecticidal net. But the nets can only kill the mosquitoes when you are under them. What about when you go out, or the mosquitoes that never enter inside? Well, the next speakers will talk about the wars that fight against mosquitoes.
Poisons on our walls, and it's been saving lives. Indoor residual spraying, IRS. Trained teams spray insecticide on every interior wall in a house. Mosquitoes land to rest after feeding, but they do not come back alive. IRS slashes transmission by 60 to 80%. It's been used since the 1950s. DDT was the original. Today, we use safer alternatives such as pyrethroids, organophosphates like pyrimidine methyl, and special repellents just recommended by the World Health Organization in 2025.
We're going after the adult female and mosquito. We're not going after the larva. In the larva source management, we're going to be talking about some of the ways that we can actually mitigate the growth of these adult Anopheles female mosquitoes. So, we are going to be talking about the environmental control, the biological control, and the larvicide. In the environmental control, we are going to be talking about more of sanitation, where we're going to make sure that every stagnant water is properly cleaned and drained so that they don't have anywhere to breed. Then, in the larvicide, it's more like introducing a bacteria that specifically targets these larvas. Then, in the biological control, it's more like allowing nature to take its toll on them.
Intermittent preventive treatment in pregnancy, IPCP. Anti-malarials are given during routine checkup in pregnancy. This is because pregnant women are in vulnerable group. Malaria in pregnancy isn't just dangerous to the mother. It causes severe anemia, stillbirth, and significant weight loss. This is sulfadosine pyrimethamine. It is given at the 2nd and 3rd trimester in pregnancy to cause significant reduction in neonatal mortality. If you are a pro-life in any sense, being it biological, humanitarian, you should treat malaria in pregnancy as one of the most important cases.
In Africa, in Sahel and sub-Saharan regions of Africa, malaria isn't year-round. It mostly occurs during the rainy season, so we give kids monthly anti-malaria courses for like 3 to 4 months. This method has so far prevented over 10 million cases of malaria yearly. And the beautiful part of this whole thing is that it is cost effective. And another beautiful thing is that healthcare workers move from doorsteps to doorstep looking for these children to give them drugs at different regions.
Let's say now the patient is discharged, they're usually given a slip that says you are clear now or you are better now. That doesn't always mean that you're safe. Let's say for instance now, the patient is hospitalized due to severe malaria. If that is usually associated with severe anemia, the patient's immunity is usually said to be compromised. And when this patient is being introduced into the community once again after being discharged, there is a risk of the patient getting the malaria once again. But this can be prevented. How do we prevent this? You can prevent this by doing post-discharge malaria chemical prevention. How does this work? This works by administering the patient a drug that the patient takes a week after being discharged. This prevents the patient from getting malaria once again. This is done not because of the patient is sick, but it's done to prevent it. Which drugs can we use for this? We can use drugs such as artemether lumefantrine or dihydroartemisinin piperacin.